Hello, today we will talk about a very common plastic surgery procedure called skin grafting. Skin grafting is a surgical procedure which involves transplanting skin from one part of the body to another or from a donor to a recipient in order to repair damaged tissues or tissues lacking skin and giving a cover. This type of surgery is often performed on patients who have suffered burns or traumatic injuries or had surgeries which have resulted in skin loss. So, skin grafting is almost synonymous with plastic surgery. In the sense, for most lay people, plastic surgery equals skin grafting. However, we know that plastic surgery involves a whole spectrum of surgeries, one of which is a skin grafting. There are two types of skin grafting procedures called a split thickness skin graft or a full thickness skin graft. The two are different based on their thickness. Skin grafts are also divided into autografts and allografts. Autografts are when the skin from the same person is transferred from one part to another, and allograft is when skin from another human being is used or from another individual of the same species. Coming back to the difference between a split thickness skin graft and a full thickness skin graft. A split thickness skin graft consists of the entire epidermis and a varying portion of the dermis. These grafts do not contain hair follicles, sebaceous glands or sweat glands. The outcome of a split thickness skin graft is that it is usually dry, much thinner, and has a lesser appealing cosmetic appearance. A split thickness skin graft is very useful in large surface area skin losses which you need to cover so that the wounds heal quickly. Based on their thickness, split thickness grafts can be further divided into thin, medium or thick grafts. Full thickness skin grafts, on the other hand, consists of the entire epidermis and the entire dermis. This is similar to the normal skin, especially in terms of color, texture and scope for hair growth, sweating, etc. Full thickness skin grafts are used when the skin losses are in cosmetically important parts of the body, like in face where there are injuries or burns which have caused skin loss and need skin replacement. Also over joints, a full thickness graft will be better. So full thickness skin grafts have better functional and cosmetic appeal, and they are much superior than split thickness skin grafts. When are skin grafts required? So the indications of skin grafting is when it is not possible to use local skin flaps or other reconstructive procedures like primary closure or healing by secondary intention to heal wounds. In such cases, the missing or damaged skin is unable to heal itself. So here we have skin grafts taken from one part of the body to cover these areas without skin. Most common injuries suitable for skin grafts are burn wounds, traumatic skin losses like following accidents when you have degloving injuries, surgery to remove skin cancer when there is tissue defect and you need replacement of skin. Some infections need skin grafting to heal the wounds. Bed sores can need skin grafting. Large ulcers or non-healing ulcers, once they come into the healing phase, they require skin grafts to get the wound healed. Skin grafting surgery involves the following steps. First is anesthesia. It's usually done under general anesthesia or regional anesthesia depending on the area where the skin needs to be grafted and the dimensions of the skin graft. Next is harvesting the skin graft. The skin graft is harvested from usually the donor site is the thigh. Most commonly the inner thigh or the back of the thigh is used so that these areas are not usually visible in normal clothing. The skin graft is removed using a special knife called Humbee's knife or an instrument called a dermatome. The skin graft that is harvested is then cleaned, trimmed and to the appropriate size, and it is shaped for transplantation. Now the grafting per se, the wound where the graft needs to be used is prepared by washing, cleaning and scrubbing the area thoroughly, achieving good blood control, that is achieving control over the bleeding, and the graft is then placed on this wound and sutured or staples are used to anchor it in place. Subsequently, the grafted area is dressed and immobilized so that the graft takes up the shape of the wound, heals it completely without moving or without getting sheared from the wound. It takes about 10 days for the grafts to be completely accepted to the new bed. Post-op care following skin grafting is essential to ensure that the graft is taken up completely. So there's immobilization, there's treatment of infection with antibiotics, patient has limited or restricted mobility, and frequent dressing changes to ensure that the graft is adhering well. In conclusion, skin grafting surgery is a complex surgical procedure which involves transplantation of skin from one part of the body to another. Skin graft is also one of the most common plastic surgery procedures done in very basic injuries to highly complex injuries. Skin grafting is a plastic surgeon's best friend also, as in many cases when flaps are not possible, we always bank on a skin graft. Often patients have concerns regarding the appearance of a graft. A graft is not as good as a flap in the sense it is inferior in its appearance. However, if maintained well and taken good care of, it blends well with the surrounding skin and can look as good as a flap. So a lot of dedication is required from the patients to take care of their grafts.